Ever had that irritating ringing or buzzing in your ears that no one else can hear? You lie in bed, the house is silent, and it's all you can focus on. I'm Dr Sophie GP, and I see this all the time with my patients. And the good news is there are simple, practical things you can do that make a real difference. Let's get into it. Why does it happen? Well, think of your hearing system like a radio. When the signal from your ear to your brain isn't coming through properly, maybe because of age, noise damage, or something else, the brain turns the volume up, searching for a signal. And instead of silence, you get static. Now that static, that is the tinnitus. It can be ringing, buzzing, pulsing, hissing, humming, can be one ear or both. And some people only notice it now and again, but for others, it's 24/7 and really intrusive. And the frustrating part, you can't just turn it off or walk away from it, can you? When should you get it checked? So most tinnitus isn't serious, but do come and see someone if it's only in one ear, if it's in time with your heartbeat, if it started very suddenly, or if you have hearing loss, dizziness, or you just feel off. We usually start with a hearing test and an ear check. So what can actually help? Unfortunately, there isn't a magic pill, but there are loads of ways to make it less annoying and help your brain tune it out. So firstly, fix the fixable. Often it's earwax, so that's very nice and simple to fix. It could also be an ear infection or a medication that's to blame. So we sort that out and the tinnitus often improves dramatically. Secondly, don't sit in silence. Silence makes tinnitus raw. So have some soft background sound. TV, music, a fan, or a white noise machine. And there are apps with gentle rain or ocean waves that can be a lifesaver at night. Some of my patients swear by pillow speakers or sleep headphones, so only you can hear the sound while you drift off and you won't irritate your sleeping partner. You might have seen some bone conduction headphones on social media which let you listen to podcasts or audiobooks without blocking your ears. So your own voice and outside feels natural, but your brain has something else to focus on instead of the ringing. And you can even get hearing aids that double as sound generators, giving you a soft background noise all day so the tinnitus fades into the background. Thirdly, I would say manage your stress and sleep, because stress and poor sleep makes your tinnitus worse. So things like mindfulness, gentle exercise, and CBT, which stands for cognitive behavioural therapy, these can help retrain your brain so it bothers you less. And what about new and emerging treatments? You might have seen headlines or TikToks about new devices for tinnitus that retrain the brain. This is called neuromodulation. It basically means giving your brain very specific sound patterns, sometimes paired with gentle pulses to another part of the body to help it tune out the tinnitus signal. One example was really interesting, I thought. It was sound plus gentle tongue stimulation. Yeah, I was pretty surprised to find out that your tongue can help with tinnitus. So the idea is you wear headphones with special tones and a small mouthpiece that gives tiny pulses to your tongue. Now, early studies show it can help some people notice their tinnitus less, but it isn't a cure, unfortunately, and it's not right for everyone. There's also something called vagus nerve stimulation, which can be done with a small device on the ear or the neck or surgically, which is very much still in the research stage. So we'll keep posted for what's happening with that. And you might have heard of notched music, where certain sound frequencies are filtered out to calm overactive hearing pathways. Some people say it helps, but the big medical guidelines don't recommend it because the evidence is mixed so far. So for the moment, these are interesting add-on options being studied, but they're not replacements for the things we know work best, like hearing care, CBT style therapy, good sleep, and sound masking. Okay, so let's just do a little quick bit of myth busting, things you might have seen on social media. Ear candling looks dramatic, but does nothing except risk burns, unfortunately. Magnesium sprays. Nope, no solid evidence. Miracle drops or supplements. Oh, I wish they worked. That'd be nice, wouldn't it? But the research just isn't there. And to be frank, if something sounds too good to be true, it probably is. So let's stick to the simple evidence-based things we know really do help. So what is the outlook? Well, for a lot of people, tinnitus fades into the background over time. Your brain learns to tune it out, and with a few tricks up your sleeve, it stops being the star of the show. So now you know why tinnitus happens, what helps most, and even some of the newer treatments being tested. If you want more practical, no-nonsense health advice like this, take a look around my channel. I cover everything from ear health to sleep, stress, and beyond. I am Dr. Sophie GP, here to help you better understand your health and feel more in control. See you next time.